Hello and welcome to Shining Waters Yoga. This is the second class in our series for chronic low back pain. I highly suggest starting with the first class, especially if you're having acute pain. Well, the best thing for acute pain would be rest, but as you're starting to feel like you want to stretch and move a little bit, and of course, after talking to your doctor, I suggest that first class. It's all seated and on the floor, really gentle exercises. Today it's still going to be gentle, but moving forward a little bit, we'll do a little bit more core work today. We're going to get into the hips. So again, in the first class we talked about back pain being caused by a variety of different things, and I'm not going to repeat that. So again, good to go back to that first class and start there. But as you want to maybe progress and move on a little bit, would be the next class in that series. All the same things apply. Always check with your doctor first before you start exercising. And yoga is mindful movement. So you are listening to your body at all times as we're exploring this movement today and these breath practices. Anything that doesn't feel right to you, please, stop, rest, go back to something else that we did. The idea is for you to try different things and see what works for you, and not everything is going to work for everybody. There's not just one prescriptive treatment for back pain, but some of these things have been tried and researched, and there is some evidence-based protocol. But again, you know your body, and listen to you. That's what it's all about, self-empowerment. So we're going to start seated today. We started cross-legged last time. I want to give you a different option to sit in Vajrasana. And again, some of the things we're going to do today, we're going to be on our knees. So I suggest, if you have them, none of these props are required, but if you have them, you might want to use blocks. You might want to use a strap at the very end. We're not going to use it right now. A strap could also be a belt, a scarf, even a long towel, something you can grab and hold on to that's similar to this. A dog leash works. Again, we'll use it later. And a blanket, especially if you do have knee issues, you might want to pad your knees for a couple of these exercises, or you may want to skip them. So everything that I do in the beginning here, seated, it's important for you to be comfortable. So if you're not comfortable in Vajrasana, it's the kneeling posture, and I'm going to give you some ideas that may help you be comfortable with the heels under the buttocks. You might want to just start seated in a chair. You want to have a long spine, and we'll take a few moments to check in with our breath. Now, one option here that will take some of this deep flexion of the knees, take some of the stress off the knees, is to sit up on a block. So you could place that block in between your feet. Some people even can use 2 blocks. For me, that's way too much. I almost feel like that dumps my body forward. So we don't want to be leaning forward, but nice and straight. The other option, once you have that block under there, now some people like to have actually a blanket underneath their feet. I don't need that padding, but I do like to place a blanket on top of my block, so it's between my heels and my buttocks. And again, it encourages a nice long spine. I can sit up tall, and I can feel my diaphragm expand and my breath, as well as encourage that long spine. So if you have low back pain, we certainly don't want to round into the lumbar spine. So that's one option. That's how I'm going to start sitting today, because it's comfortable for me. So you check in with you, and if this is not comfortable, I suggest starting in a chair, just seated. So take a moment to allow yourself to be comfortable. And we will use a mudra today. Last time we used Merudanda, which is the thumbs up, and the other fingers are curled into the palm. And today we're going to do Adho Merudanda, which is what I called it last time. My brain was not functioning properly. So with if we take Merodanda and then we place the palms down so the thumbs are facing inward, this becomes Adho Merodanda. And you can play with those too. You might notice the first one, Merodanda, as you kind of press down into your legs, it encourages you to sit nice and tall. And it's even very slightly energizing. So you might notice that, you might feel for that. It encourages length in the spine. And when you turn the palms down and the thumbs in, it's a little bit more calming and grounding. So sense that. You might sense that it directs your awareness and your breath towards the pelvis. And we are going to get into a little bit of hip movement today. So feel your breath again, the low belly, expanding as you inhale, softening as you exhale. Breathing in and breathing out. Start to cultivate that even breath, Samavriti. See if you can match the length of your inhale to the length of your exhale, or vice versa. So if you breathe in for 2, 3, 4, you'll breathe out. 2, 3, 4. If you can breathe in, 2, 3, 4, 5. You'll breathe out. 2, 3, 4, 5, and so on. Whatever the count of your in-breath, see if you can match that with your out-breath. And it might take a few breaths to settle in. Notice if you're struggling at all. We don't want the breath to be a struggle. So be gentle, be easy with yourself. And you might begin to notice that little pause at the top of the breath once you've inhaled fully. And then exhale fully. And notice that pause at the bottom when you're empty of breath. And continue. Let's just do maybe 3 more rounds of breath here. Check in, make sure you're not slouching or rounding into your lower back. You might breathe a little faster or a little slower than me. Move at your own pace. We're establishing that pace right now. So at the end of your next exhale, go ahead and blink your eyes open. Maybe notice just how you feel after breathing, feeling the breath. And let's go ahead and warm up our shoulders just a little bit, taking the fingertips to the shoulders, circling the elbows forward, up, and back and down. Breathing in. And then reversing that direction, bring the elbows up and forward and down and back. Just loosening up shoulders a little bit. And then inhale, open the arms wide. As you exhale, cross your arms right on top to start. Grab your left elbow with your right hand, right elbow with the left hand. We're just going to take a little twist here. So take it slow at first. Notice your range of motion, side to side, any discomfort. So bring your awareness to your back. Notice any discomfort there. And then inhale, open the arms wide. Stretching the arms out. As you exhale, cross the left over top. Again, grabbing the elbows with opposite hands and just a little twist side to side. Just warming up the muscles there on the mid-back. So we'll do some mid-back stuff. We'll also do getting into the hips. We're just warming up to start with. And we're also going to warm up our neck a little bit today. So relaxing the arms down. Take a nice deep breath in, and as you exhale, release it out. And just start to notice here your range of motion with your neck. So just a little lift with the chin, not taking my head way back, soften through the shoulders. And then as you exhale, tuck the chin, lengthen through the back of your neck. Again, I'm not bringing my head forward at this time, just tucking the chin, lengthening through the neck. Inhale to release that. And just notice your range of motion. So if you have any neck, any cervical spine issues, you may not have a lot of range of motion here. We're not forcing anything. We just want to warm up these muscles a little bit before we do any further movement. And also we're becoming consciously aware of what is my range of motion here. And then inhale, come back to center, and we'll do the same thing. Head side to side. So as you exhale, just turning to the left. Notice your range of motion without getting your right shoulder involved or twisting. Just taking your head to the side. Inhale back to center and exhale over to the right. And then inhale to center and exhale over to the left. Breathing in to center and exhaling to the right. And then come back to center. Last thing we'll do here is just gently take the chin over towards your left shoulder as you exhale. Inhale to center and exhale the chin over towards the right shoulder. And inhale to center. Exhale the chin over towards the left shoulder. So there's a little bit of tucking the chin, a little side to side movement. Inhale to center and exhale chin towards the right. You're super mindful here. Let's do one more each side. How does your neck feel? If anything doesn't feel right for you, remember you're going to skip it. And exhale the chin over towards the right shoulder. Release back to center. Just a couple shoulder shrugs. Just contract and release. Contract and release. Contract and release. All right, I'm going to come off of my block and shift my hips over to the left, bringing this left foot in alignment with the right thigh. So here, if your left knee is way up in the air, you might even place a little folded blanket. Again, this blanket is useful for so many things. You could pad it with a blanket. If your knee feels okay hanging out there and you don't need that, that's fine too, or if you don't have the blanket. So you might notice, again, a little bit of knee flexion going on. We're gonna have that for a few of these postures today, so be mindful of your knees. We're gonna take the right hand right to the right waist, just above your hip bone, and then inhaling, lifting up. As you exhale, we're gonna come to a little twist and lift your right hip up as you twist to the left. So I'm on my left hip, my left buttock. And then as you inhale, release back to center, and that hip bone's gonna come back down. As you exhale, take that twist, lift the hip up any amount as you twist to the left. And inhale back to center. It's a small movement, so if you feel like you need to do something really big, that's not what this is. Exhale, twist, lift that right hip up. And inhale back to center. I think our culture always wants to supersize everything. Exhale, lift that hip, turn to the left. And sometimes we just need to be gentle with ourselves. Inhale back to center. Let's do one more. Exhale, lift the hip, turn to the left. And Inhale back to center. We're gonna do something a little bit different. So my left hand's right on the floor behind me. I don't know if you can see that. I might just shift this way a little bit. I'm gonna take my right hand to the left shoulder. Again, I'm gonna twist to the left, lift that hip up, but I'm gonna look to the right. Look over your right shoulder. It takes a minute to coordinate this one, so don't worry if you don't get it right away. And then release back to center. Your right elbow is gonna come back to center. You're gonna look over your left shoulder. Taking that same twisting movement as you exhale, lift the hip up, but we're gonna turn our head to look over the right shoulder. As you inhale, come back to center, look over your left shoulder. And again, don't take the head movement too far. Inhale, lift the hip, look over the right shoulder. Exhale, release, back to center, look over the left shoulder. Let's do that one more time. As you inhale, that right hip up, look over the right shoulder. Exhale back to center, the hip comes down, look over the left shoulder. And release your hand. We're gonna come into a full twist. So let that right hand come outside the left thigh. Breathe in, sit up nice and tall. As you exhale, come into the twist and hold. So that right hip might come up, that's fine. You could also take both hands to the floor, sitting up nice and tall. And then release, come back to center. Take another big breath in. So now my torso is facing between the two knees. Take the hands in between your two knees. Sit up nice and tall on your in-breath. As you exhale, making sure you don't round in that lower back, just walk the hands forward a little bit. So some of you might come a little bit forward, maybe a little bit more, maybe a little bit more. Again, it's going to depend on your range of motion. Checking in with your lower back, make sure it feels okay. You're probably going to feel this more in your left hip. So stretch on that left hip. Breathe in. So some folks might be able to come all the way down, but again, if you're having back pain, you may not be able to do that. So it's not about forcing yourself into a posture, but getting a little stretch here in the hip and the low back. And depending on what's causing your back pain, this may or may not be helpful for you. We're going to move the spine in all directions through this class. So let's go ahead and walk all the way back up. We're going to come to the other side. But before we do, let's bring the feet out as wide as the mat. Hands behind you, and just do a little windshield wiper movement. Take your knees side to side, just warming those hips up a little bit before and between sides. So there's an internal rotation of the hip and then an external rotation of the hip, side to side. And the next time your knees come to the right, we're gonna stay there, sit up, and draw that right sole of the foot to the left thigh. Bring your left foot behind you, the heel towards your glute. Same things apply if you want a blanket under your knee. You might notice one side more flexible than the other. It's not unusual. So we're gonna start with that little hip lift. Take your right hand somewhere like basically under your right shoulder, and left hand right to your left hip. Take an in-breath. As you exhale, remember we're gonna twist to the right, lift that hip up. Inhale, come back to center. Exhale to twist to the right, lift that hip. Inhale to center. Exhale to twist, lift that hip. So this is a sacroiliac joint stabilizer. Inhaling back to center. And exhaling to take that twist. Inhale, come back to center, pause there. We're gonna take the left hand now to the right shoulder, same twist. So complete your breath cycle. When you're ready to exhale again, take the twist. You can lift your hip up, turn to the right, but take your head to turn towards the left, as if you're looking over your left shoulder. Inhale, bring that hip down, look over the right shoulder. Exhale to the twist, lift your hip, look over the left shoulder. Inhale to center, hip comes down, look over the right shoulder. Exhale to the right, the body twists, look over the left shoulder. And inhale, come back to center and release. And so if this is an exercise that helps you, you might do more repetitions. You might just do that for a little while. But we're gonna go ahead and move on, coming to the full twist. Take your left hand now outside of the right thigh, twist to the right. Big breath in, lift up nice and tall. And exhale, draw the belly in. Take another breath or two here. Exhaling, release, back to center. Bring your hands right in between the thighs now. On an in-breath, lift up from the chest. Keep the lower back stable. Don't round there. Exhale, you're hinging forward. Think about leading with your chest. So for some folks, this might be your stopping point. Notice what you're feeling in your knees. Again, if you have a knee injury, this may not be the best exercise for you because it does require some knee flexion. So we're just working on back and hips as our primary focus. You might be able to come down to your forearms. Again, some people can come all the way down, but check in with what feels right for you. For some folks, these forward folds can be helpful and these hip stretches. For other folks, the back bends might be more helpful in making some space there for your spine. We'll do a little bit of that today. We're going to do more back bending in the next class in the series. So let's go ahead and release that one more time. Take the feet as wide as your mat. Let your knees go side to side. Let's just release any tightness, any tension that we may have created in the knees, the hips. Letting go. And then we're gonna come on to all fours. We did this in our last class. We're gonna do it again to get some spinal flexion. You might wanna pad your knees with your blanket. Again, I've got a double pad here, so I don't need additional padding, but go ahead and pad up your knees if you need to. Your knees will be hip width apart, your hands will be shoulder width apart. Be mindful if you have arthritis and this is too much to be on your hands. You could come back and do it seated. We're gonna do the tiger breath. So as you inhale, we're gonna lift the sternum away from the navel. So there's a little arch to the spine. And as you exhale, you're gonna focus on drawing the belly in. So from all fours, inhaling, arching the spine, looking forward, sternum away from the navel. On the exhale, drawing the belly in. Inhale, look forward. Sternum away from the navel. Exhale, draw the belly in. Inhale, look forward. Move with your breath, sternum away from the navel. Exhale to draw the belly in. One more. And release back to center. And now we're gonna do a little side to side movement. If you need to give your hands a break, maybe take fists or come off of your hands for a moment. You can always stretch your wrists. Release your fingers, do a little figure 8 movement. Maybe press the palms out. So just releasing that, inhaling, arms overhead, and exhale and release the arms down. We'll come all the way back. And a little side to side movement. So we're gonna look over the left shoulder and draw your hip towards you. So there's a little like cinching of the waist. And then release to center and look the other direction towards the right shoulder, drawing the hip up. So some people call this wagging your tail. You can see as your hips go side to side. And you're also taking your head side to side. And release back to center. Once again, we're gonna extend the left foot, press through the heel. Go ahead and lift that foot up. And as you inhale, we're gonna think about sternum away from the navel, looking forward. Bend your knee, maybe lift that leg up a little bit. And as you exhale, you're gonna draw the belly in and draw the knee towards the chest. Make sure your right knee is in line with your right hip. Inhale, take the leg up and back, look forward, sternum away from the navel. Exhale, slowly, slowly draw that knee into your chest. So again, be really present and mindful for your low back here. Inhale, look forward, arching and lifting. Exhale, draw the knee in. One more time this side. Inhale, lift that leg. Look forward. Exhale, draw the knee in. Inhale, extend the leg, press through the heel. Step your left foot now across, over to the right, across your right foot. And once again, look back over your right shoulder. Feel that little stretch in the left side of your body. Breathe. You might want to pause for a couple of breaths here. And then release that knee back down. And in between sides, let's inhale into the cow posture, looking forward, Vinyasana. As you exhale, sink your hips back to your heels. Come off of your hands, give yourself a little rest here. Maybe you bring your forehead down to the floor. Again, we did this last week. You can also take your forehead to the block. Some of you might want to sit on a block if you need a little bit more higher lift for your hips. So keeping all of that in mind. Feel a stretch in your lower back. And then inhale, slowly, gently come back up. We'll do the other side. So let's extend the right leg back, press through the heel, get that little stretch in the back of your leg. And then lifting that leg up, bend the knee. Inhale, lift it up, look forward, sternum away from the navel. Exhale to draw the belly in, and the knee comes to the chest. Inhaling, lifting that leg up and back, look forward. Exhale, draw the knee in towards the chest. Belly releases in. Inhale, leg comes up and back. Be mindful not to take your head way back, so you're just looking forward. Think more about the sternum away from the navel. Exhale, draw the belly in, knee to chest. We've got one more. Inhale, look forward. Exhale, knee to chest. So a little bit of core work here. Go ahead, extend that leg back, press through the heel. And we'll get into our side stretch, crossing that foot over, looking over the left shoulder. Big stretch in the right side body. Breathe in and exhale it out. And then release that knee back to center. So let's pause here for a moment. We're gonna, I'm gonna demo downward facing dog. This is an inversion. It's really nice for stretching your back, the back of your legs. But I'm going to give two options. So if you don't want to invert by taking your head below your heart, that makes you dizzy, you can do this at the wall or with a chair. Also, if you don't want to put the pressure of the weight of your body on your hands due to arthritis or any other reason, again, you might want to take it to the wall or the chair. So I will show it both ways. From our all fours, we're going to step our hands a little bit further forward, spread the fingers wide, and we're going to tuck our toes under. In a minute, we're going to lift our knees off the mat. But as we do that, we're going to press down through the base of your index finger and your thumb so that you're not pressing on the outer part, the pinky part of your hand. And then taking a breath in as you look forward, just as we did before. As you exhale, engage your belly, draw your belly in, toes tucked under, start to push away from the mat. Lift your knees, and right here, maybe notice how that feels. You're lifting your weight off of your hands, so you're really not putting a lot of pressure on your hands. You're engaging your core. If you want to, you can come back down. Take a pause there. Inhale. Look forward. As you exhale, draw the belly in. Once again, root down through the base of the index finger and the thumb. Go ahead, lift up. If you want to start pedaling your feet, straightening one leg and then the other, you can do that. Pedaling for your feet. Engage your tricep muscles, that's these upper arm muscles, back and apart. So you're engaging your arms, your core. You're not dumping the weight of your body on your hands. It should feel good. If not, if this is not for you, then you're gonna take your time. You're gonna come up to stand. And you can do this at the wall or with a chair. I'll show it both ways. So those of you doing down dog on the floor, take a break, bring your knees down, and then maybe do another one and take a break. So from the wall, or you can fast forward this part, your hands are gonna be shoulder width apart. You're gonna start in line, wrists in line with the shoulders. Start to walk your feet back so that they're about hip width apart. And pushing into the wall, allow your head to come down between the arms. Same basic posture, but without taking my head below my heart. And I realize, I apologize, you can only see that from my back side here. The other way is take your chair, and really you could use the highest or the lowest part. I'm gonna use the lower part, taking my hands to the sides of the chair, or even the seat of the chair, and starting to walk my feet back. Same thing, I'm gonna push the chair away so that I get that stretch in my back. My head comes down between my arms, and I'm still slightly inverted here. So if I were to do this at the back of the chair, there would be less inversion. It depends on what feels okay for you. When you come up from the standing posture, be very slow and careful. So start to shift forward, walk your feet forward, come up slowly. So you're not doing that very fast rising up from putting your head below your heart. If you're on the floor, again, you can walk your feet to your hands, you can walk your hands to your feet, you can come into a little squat, slowly come up to stand. So, and you can come to the top of your mat. We're in a standing posture now, so we didn't do any standing in last week's class. If you have a block, you can take that block now, squeeze it between the inner thighs, relax your shoulders, draw your belly in, lengthen through your tailbone, see if you can lift your toes, make sure you're not gripping your mat, relax your shoulders. Mountain pose, feel all the muscles that are working. Notice how your back feels here. Does it feel good to just stand upright? Breathe in and breathe out. And then from here, let's inhale the left arm up and take your right hand to your waist. As you exhale, just take a little side bend. Maybe look up, maybe just look forward. Take another breath and exhale it out. Inhale, come all the way back up, and exhale, release. Switching sides, left hand to your left hip. Inhale the right arm up, and exhale over to the left. Again, I'm squeezing my block. Maybe look up to the sky or just look forward. It depends on what feels more comfortable for your neck. Take another breath in, and another breath out. Inhale to come all the way up, and exhale, relax the hands. From here, we're gonna come into a forward bend. Same thing is gonna apply if you don't wanna bring your head all the way down into the full inversion, if that makes you feel dizzy. I'm gonna keep my block here. You can take it out if you want to. But it's nice to actually feel the engagement of your leg muscles. So feel your legs squeezing that block if you choose to use the block. We're gonna inhale the arms overhead. As you exhale, bring your hands to your hips. Start to hinge forward. Make sure you're hinging forward from your hips and not rounding from your lower back. So anytime we come forward, we're hinging, we're lengthening through the spine, not compressing and rounding. And you might take your hands to your thighs or your shins, or to a pair of blocks. I'm using my block, so I only have one block right now. Lengthen through your spine. Feel that stretch there in the backs of the legs. Go ahead, take a soft bend to your knees and come up with a flat back. Don't round up. Never do that, particularly if you have back issues. I'm going to show it now with both blocks down, and I'll give you an option to fully fold forward. So from here, inhaling the arms. As you exhale, hinge forward from the hips. Come forward with a long spine. Maybe you stop halfway, keeping your head in line with your heart, hands to your shins or to your blocks. Take another breath in here. If you want to fully forward fold, as you exhale, you can drop your arms. You can let your torso hang over your legs if it's comfortable. So remember, for some folks, these forward folds create a nice stretch here in the lower back, and it might feel good. For other folks, the back bending might feel better. So if this feels good, take a couple breaths here. Let go of any tension in your shoulders and your neck. As you take several breaths, you might feel a little more release. As you inhale, think about lifting your hips up towards the sky, and as you exhale, softening your belly. So if your hamstrings are really tight, you might be a little bent here in the knees. That's fine. We're bringing the belly towards the thighs in this forward fold. Some of you might be bent deeply. Inhale, come halfway up. Exhale, soft bend to the knees, come up with a flat back to stand. Deep breath in, exhale it out. One more thing I want to mention with these forward folds. Some of you, if your pelvis is naturally tilted back, you're going to probably have really tight hamstrings. It might be super helpful if you take a little bend in the knees. Inhale, lift your sternum away from your navel, and then exhale, come forward with the bent knees. And you might just come to a half fold, or you might come to a full fold. Again, it depends on your range of motion. Once you get there, you might be able to straighten the legs a little bit more or not. So just feel in for that. You're not trying to force yourself into any shape. Walk your hands back to the block. Inhale. Exhale, soft bend to the knees, come up with a flat back, and exhale, hands to your heart. So from here, from the top of your mat, you'll be facing forward. I'm just doing it from the side so you can have a better view. We're gonna come into more standing postures, and we'll come back down to the floor. A little bit of core work. So from our standing mountain pose, our feet are hip width apart, in line with our hip bones, not the widest part of our hips, but our hip bones. So we're gonna start with the left foot. We're gonna step that left foot back, a big step back. Far enough back that as you bend your right knee, it's not going out over your toes. We want that right knee in line with that ankle. If you have any balance issues, you can do this with a chair. So you can have your chair here, hold on to it. Just make sure, again, as you bend the knee, it stays in line with your ankle. So there's a tendency to do this, right? So you want to lift up, lift up, lift up, or hold on to your chair, which is possible. I just have my blocks in the way. You can be here, right? Lifting one arm up, maybe both arms up if you're okay with the balance. Now my back heel is down, hips forward, ribs forward, chest forward. Breathe in, reaching those arms up. And then as you exhale, we're gonna hinge forward from the hips, bring the arms down and behind you. Now I'm hinging from the hips, I'm not rounding from my spine. Press down through that back foot. As you inhale, come all the way back up. As you exhale, draw your belly in. Arms come down, press through that back foot. Inhale, press through that front foot as you come back up. This is core work, also strong back. Exhale, hinge forward from the hips. Any amount. Inhale to come back up. Exhale, hinge forward. Inhale to come up. And exhale, hands to your heart. Step your back foot forward. Pause in mountain pose. Notice how you feel. We're going to do all of that on the other side. So again, and many of you may not need this chair if you're okay with balance. So we're going to step that right foot, a big giant step back. If you don't feel comfortable stepping back, you can always do the opposite. Step forward. Left foot would be forward, right foot back. Come into that knee bent posture. Make sure your knee stays in line with your ankle. Or a little bit behind, not over your toes. So, hips are forward, back heel is down, drawing the belly in. If you need something for support, you could hold a chair. Also, sometimes hands to the thigh or the hips is a little bit more grounding for your balance. If you're okay, take an arm, maybe both arms up. Soften through your shoulders. Big breath in. Think about that sternum away from the navel. As you exhale, hinging forward from the hips, reach forward. Strong legs, strong glutes, arms come back. Inhale, lift all the way back up. The legs stay the same here. As you exhale, you're hinging forward from the hips, arms come back. Use your core, draw the belly in. Strong legs. Inhale, come up. Take your time with this. Move slowly. Exhale, come forward. One more time. Inhale, come up. Exhale, hinge forward. Inhale, come all the way back up. Exhale the hands to the heart. Step the back foot forward. Pause, notice, you might march it out a little bit. Lifting those knees up. And wiggle the knees out. One more thing we're going to do here. Taking the heels of the hands, so we did a nice forward fold, which, remember I said some folks, the forward fold feels better, other people, the back bending feels better. So taking the heels of your hands to your lower back, right at the back of your pelvis. And you're gonna squeeze the elbows towards each other, squeeze your shoulder blades towards each other. Again, think about lifting your sternum away from your navel, just like we do in the four-footed postures. Inhaling, lift up, maybe lean back a little bit if it's comfortable for your back. For some folks, this gives a release. As you exhale, come all the way back up. Hands to your heart. Deep breath in. Exhale it out. Breathe in, reach the arms overhead. And exhale, hinge forward. Hands to your blocks, to your chair, whatever you have. We're gonna pause here. And then we're going to step one foot back and then the other, come all the way back down. Come to sit on your heels if it's comfortable for you. You can always pad up with your blanket. If this is not comfortable, you're going to repeat that standing posture that we did just now with the heels of the hands on the back of the pelvis. We came into a little back bend. So we're going to do this standing on our knees. Knees are in line with your hips, so they're not really far apart. You want to feel sturdy and stable. Feet can actually be untucked or tucked, whatever feels better for you. Heels of the hands, back of the pelvis. Draw the elbows back, shoulder blades back. Inhale, lift sternum away from the navel. So I'm not pushing my pelvis forward. I'm resting my hands there. You can also do this with the arms down, but there's a tendency to go too far. So keeping your hands there keeps you nice and steady. Maybe lifting the chin slightly, but I'm not taking my head way back. So feel for that. It's just a little bit of a back bend. If it's too much, come out. Breath in. Exhale. Inhale. And exhale. Release. Come to sit on your heels. If you like, you could come all the way back down into the child's pose or Dharmaka Asana. So bring your head down, maybe to a block or to the floor. In the counter pose, so coming back to that forward bend. Again, see which one feels better for you. Explore, take your time. Don't move into any posture that creates strain or pain. Go ahead, walk your hands back. Start to lift up and come all the way back onto your back. And here's where we're gonna use our strap in a moment. All right. So when you come onto your back, you want your feet pretty close to your bottom. So it's easier to see that when you're sitting up. You can scoot your bottom towards your heels, start to come all the way back onto your back. If you feel like your neck needs a little support here, you could always put a folded blanket underneath your head. In fact, we'll demo that. So a little support. It really depends on the curve in your neck, whether or not you're gonna need support here. So actually, you know what, we're not gonna use that just yet because I wanna do a bridge pose first. So we're gonna come into bridge. We want the heels close to the hips, arms at your side, palms face down. Once you're there, root down through your feet and just pressing down through your feet, pressing the feet to the floor. You'll feel the hips want to lift up a little bit. Breathe in, lift the hips up a little bit more if you can, lifting the spine, maybe walking the shoulders underneath. Reach the right arm over your head, let the palm come back behind you, or the back of your hand come back. And then exhale, slowly roll your spine down until the hips come down, let the arm come down. Again, rooting down through your feet. Inhale, lift your hips, lift your spine, lift the left arm over your head, back of the hand comes behind you. Exhale, slowly roll your spine down, let your hips come down, let your hand come down. Again, root down through your feet, inhale, lift hips, lift spine, lift right arm. Exhale, slowly roll the spine down. Let your hips relax, let your arm come down. Once more, rooting down through your feet, lift your hips, lift your spine, lift your left arm. Exhale, slowly roll your spine down. Let the hips relax and your arm come down. Pause here. We'll do one more bridge lift. This time we'll leave the arms down. When you're ready, root down through your feet. Inhale, lift your hips, lift your spine. Start to walk your shoulders underneath. Maybe turn your palms up. Some of you might be able to walk the shoulders underneath enough that you can clasp your hands under your tailbone. Use your quadriceps, your core muscles to lift up. Hold for a few breaths if you can. When you're ready, you're going to release the hands if they're clasped. Slowly roll your spine down. Let your hips relax. I wanted to show that once more with the block. If you have the blocks, and again, you don't have to have props, but it can also be super helpful to squeeze that block between your inner thighs. Beginning the same way, rooting down through your feet. As you inhale, lift your hips, lift your spine, walk the shoulders underneath. You can clasp your hands if you can walk the shoulders underneath. Squeeze the block, lift the hips. You'll really engage those quad muscles. When you're ready, releasing the hands to make space, slowly, in a controlled manner, rolling your spine down. Let your hips rest. Remove the block. Let your knees fall together. Take a break. Breathe in. And breathe out. Draw your knees into your chest, coming into Apanasana. Lengthen through your back. You might rock a little bit side to side. As you inhale, extend your left leg. Let that left heel come all the way down to the floor.
As you exhale, draw your right knee in a little bit more to the chest. Take another breath and stretch the left leg away. So we did the stretch in the previous class, Ardha Apanasana. And then switch sides. Bring the right foot down. Draw your left knee in as you exhale. Inhale to extend the right leg. Keep the heel on the floor. If your hamstring is tight, the knee might be bent a little bit. That's okay. We're going to do a little hamstring stretch in a moment. Another breath in. And another breath out. Bring your left foot down as you release. Grab your strap, or whatever you're using as a strap. If you actually have a yoga strap, you could, or a belt even, you can make a loop in it if you want, but you don't have to. 2 ways to do this. We're gonna draw the right knee in and either take the strap around the ball of your foot where you're holding one side of the strap with each hand, or you can take the loop around the foot. Either way, doesn't matter. This way allows you to just use one arm. So we start to draw that leg in, we're gonna stretch the hamstring. Now notice everybody's different. If you're really tight in the hamstrings, your foot's gonna be pretty far away. If you're pretty limber, you're gonna be able to draw it closer in. You can see people that take their head over their leg over their head. That's not me. My hamstrings are relatively tight. You can keep a soft bend here in the knee, but start to see where you can lengthen your leg. Where can you take that bend out without hyperextending your knee? You might move the foot a little farther away. And as you exhale, as you start to release a little tension, maybe draw it a little closer. Relax your shoulders here and your arms, so we're just focusing on the leg. And you want that strap to really be around the ball of the foot. You'll also get into the calf muscle. Turning your toes out and your heel in can rotate the femur bone in the hip socket a little bit. An option to go deeper is straightening the left leg. That's just an option. If you feel like that's too much, you might rebend the knee. And it might depend on what time of day you practice. In the morning, I tend to be tighter. In the evening, I tend to be more limber. My body's had a chance to loosen up. Take a few breaths here. This posture can be very helpful for people with sciatica pain. But having said that, not for everyone. So again, you might try it and see if it's helpful for you. Same with the Uttanasana, the standing forward fold. Some folks find it very helpful, but not everyone. And then we're going to go ahead, if your leg is straight, rebend the left knee, bring the foot to the floor, release your strap, bend that right knee, and bring your right heel to just above the left knee. So we're going to come into this version of sleeping pigeon, or pigeon on your back. First thing, just take your right hand inside the right thigh, give a little press, and notice the stretch in your right hip. For some folks, this is enough. You might just stay here, keeping that right foot flexed, toes towards the knee. For others, this feels like nothing. So you can lift your left foot off the floor and interlace your hands behind the left thigh and start to draw it towards you. Deepening that stretch in the right hip. So if you have back pain caused by tightness in the hips, this could be really helpful. And sometimes even just for generalized back pain, because you'll feel this is a deep hip stretch, but also gets into the lower back. Now, if you're not able to reach this leg, this thigh, and some people can even go to the shin bone, But if that's not you, if you can't reach your thigh, you could just stay in the first version, or you can grab that strap again, and you can take the strap around your thigh and then draw it in that way. Use the strap. Keep both feet flexed so that all the leg muscles are engaged. And I don't need the strap, so it looks kind of silly when I do it that way, but just so you know, there's many options here. Listen to your body, and yoga's not about trying to fit ourselves into a posture, but instead finding the posture in our bodies that may not look like a photo of someone else, or we may not be in the fullest expression. Understanding the benefits of what we're trying to achieve and finding another way to achieve it, if it's something you even want to achieve. Bring that foot down. Let's go ahead, straighten that leg one more time and release. And we'll go to the other side. So draw your left knee in and take that strap. Go ahead, strap it up. Take it on the ball of the foot, straightening the leg. Once you get there, if you want to extend your right leg and play with that, that's going to deepen the stretch. So if it's too much, just rebend the knee. Check, make sure that you're not hyperextending your knee. You might turn the toe out, the heel in just slightly. It's a slight rotation of the femur bone and the hip socket. Make sure you're not lifting your head up or creating unnecessary tension in the upper body. It's one of the nice things about the single strap. If you make the loop, you can even just use one hand. Take a few breaths here using your exhale to soften that hamstring. If your knee's really bent and you're doing this because you're trying to get your foot to your head, it's a different stretch. It's not that it's not a stretch, but it's stretching a different part of your hamstrings. So, you know, if you like that stretch, certainly it's something to explore, but it's different. So find where you can straighten your leg, even if it means your foot's pretty far away. And over time, you might bring it a little bit closer. Each exhale, releasing tension, letting go. As you're ready, bend that knee, release the strap. Ooh, make some noise. And rebend your right knee, right foot on the floor. We're going to take left heel just above the knee. It's never on the kneecap, it's above the knee. Gently press into your inner thigh. So the knee goes out to the side. Keep your toes flexed toward the knee. For some folks, this might be enough, especially if you have an active hip injury or that you're dealing with, or hip discomfort. Hip injury, you probably shouldn't be doing this. But if you're recovering from something, or maybe your hip is starting to degenerate, I've worked with a lot of people before, both pre and post hip replacement. So you want to keep those muscles strong, but again, you don't want to force anything, ever, ever, never, never. Everybody's different. So if you want to go deeper, lifting your right foot off the floor, interlacing the hands behind that thigh and drawing it in. Both feet are flexed. Some folks can grab their shin. Some folks need the strap. So listen to what your body needs. And there's a sense of resistance here. So as we're drawing the right leg in, you're resisting with the left leg. You're not just letting it fall forward, fall into you like that. I don't even know if you can quite see that. You're resisting with that left leg, feeling that stretch in your left hip and lower back. another breath or two. Release that right foot down. Uncross your legs, draw your knees in, rock a little bit side to side. Last thing before rest, let's come into a final twist. So bringing those feet down to the floor. I find it's helpful to shift my hips over to the left. So just lift my hips up, place them on the left. The knees kind of already want to fall to the right. We're going to bring our knees over to the right, but try to keep your torso, your back, on the floor, both shoulders down, particularly the left shoulder. If you're not able to do that, if you feel like that shoulder just wants to come up, then you may have to place a block or a folded blanket or pillow, something under your knees to lift the surface of the floor up. And that will make the twist less severe. It's going to raise the floor up. You might be able to keep that left shoulder down. Also, some folks like to place a pillow between their knees. That's another option, and that might be helpful as well. Once you're there, you can let your arms rest. Gazing at the ceiling, you can close your eyes. Some folks like to turn their head to the left, away from the knees. But again, be mindful if it's strain on your neck. You can also place your right hand on top of the top knee. So be really mindful if this twist feels like it's causing any discomfort in the lower back. It might be too much keeping the knees together. That's also where it could be helpful to have that pillow to place between your legs. Or a folded blanket can also work really nicely. And you'd be surprised how just making that one little adjustment, having some space between your knees, especially if you have wider hips, can create more ease in this posture. The reality is we don't all live in the same body, right? We all have different shapes and sizes and different abilities, different conditions that we might be dealing with at any given time. So find ease. Where can you find ease in this posture? Breathe into the belly, and as you exhale, soften, release the lower belly. And then when you feel ready, let's come out and go to the other side. So lift your knees back up, feet on the floor, shift your hips, recenter them. And to go to the other side, again, it's helpful instead of just dropping our knees over, which is pretty severe on your lower back. Shift your hips over to the right and then let the knees come to the left. All the same things apply. We're keeping the shoulders down. If you're not able to do that, place something under the legs or between your knees. So a pillow would work better, but I don't have one here. So I'm just going to use my folded blanket. Again, that gives me more ease in my lower back. Your arms can extend to the sides, or you can take your left hand on top of that right thigh. Take a deep breath into your belly, and as you exhale, expel all that breath. Maybe turn your head to the right. Or just gaze upward. Take another breath or two here. And release. We'll go ahead, bring the knees back up. Recenter your hips. Let's end with something nice and symmetrical. Just draw those knees in one more time. We'll rock side to side. And then setting up for final rest, you might want a nice pillow if you don't have a bolster, or under your legs. You may want a blanket to cover with and get warm. I'm going to put socks on because it is cold in here, which is why I'm teaching in a turtleneck today. So make sure your feet are warm, and you can have an eye pillow if you want, or something over your eyes if you like that sort of thing. You can hold a blanket to support your head and neck. Get all your other props out of the way and start to settle in. Most important thing is make sure that your back is comfortable. So straightening the legs, some people like to let the knees come up to the side. I find that comfortable. Your hands can rest on your belly or by your sides. And again, if you're chilly, you might cover up with a blanket. So we'll take a little bit of a shorter rest this time. But feel free to stay in this position as long as you want. Take a moment to connect with all the points of contact between your body and the floor. Take a long, slow breath in. And as you exhale, let all those points of contact get heavier, releasing into the mat, into the floor. Letting go of your practice, letting go of tension and stiffness. With each breath, breathing in fresh oxygen, energy, life force. And with each exhale, allowing that sensation of ease to flow through the body. Each breath in, nourishing your body, every cell in your body. And each breath out, releasing pain and tension, discomfort, settling into ease. Bring awareness to your feet and let your feet and ankles rest completely. Soften through the backs of your knees. Bring attention and awareness to your low back. Breathe into your belly. And as you exhale, soften through the belly and allow that sense of ease to spread all through the pelvis. Relaxing the muscles of the low back. Breathing in, imagine creating space between the vertebrae. And exhaling into release. Soften through your shoulders. Soften and release the jaws. Make sure you're not clenching your teeth. Allowing the tongue to rest in the mouth. Softening the forehead and the muscles of the eyes. Take a moment to notice how you feel right now. Observe yourself breathing and feel how your body moves how your breath moves your body. notice what happens when you slow your breath down. As you settle into ease, know that you can stay here for as long as you like. I'm going to go ahead and end the class. So when you're ready, you can begin to bring some movement back into your body, maybe wiggling your fingers and your toes. Again, you may not be ready for that just yet, but just bringing some sense of aliveness and vitality into your body after being still, some warmth, some prana. And then gently starting to draw your knees in. You can roll over to your side, taking some time to pause there. And then being really conscious of your back, taking your time to come up. Use your hands, gently walk up. Let your head and your neck be the last things to rise. Come back to any comfortable seat. Notice how you feel. Awareness of your spine, your breath. You shift or change in the mind, the body, or the breath. Thank you so much for practicing with me. This is the second in a series. Well, there's one more to come. So I hope that this class has maybe brought you some ease, that you found something useful here today. Thank you for joining me, and I wish you peace. Om Shanti, Shanti, Shanti.